This video is for those who follow me for trigger finger advice, and if you follow me for that advice, you'll know that about a year ago I was able to heal my trigger finger naturally, and if you haven't seen that video, I'm going to go ahead and put the link below for it. Anyway, very recently I had a little bit of a setback. While leaving for vacation, I got stuck holding a suitcase that weighed about 80 pounds for 10 minutes, and during that time I could feel the stress on my tendons starting to build. Sure enough, the next morning when I woke up, my finger was stuck in the lock position and I could feel a little bit of a nodule on the tendon. This was the first time I had had either of these symptoms in 10 months since I had healed my trigger finger. Unfortunately, a little earlier in the year, my daughter had to go to the hospital and our $10,000 insurance deductible has already been met for the year. So I decided instead of healing it naturally, I'm going to go ahead and have the surgery. If I healed it naturally, I may have it come back again because I'm just prone to trigger finger. But if I get the surgery, the likelihood that it will ever come back is pretty low. So, for those who are going to get trigger finger surgery, I thought I'd go ahead and show you a little bit of what I'm going to go through. That way you'll know what to expect when you go through yours. So I hope you find this information helpful. So, now let's jump forward to the surgery time. Alright, it's been about 24 hours since I had my surgery, so I thought I'd go over a little bit of the pre-surgery, the surgery, and then kind of how I'm feeling right now. So they called me ahead of time just to lay some guidelines down for the surgery, and they wanted to make sure that I cut my fingernails. Now, if you're a lady, make sure that if you have any fake fingernails, you remove those. Also, they don't want you wearing any jewelry when you go in. They'd like you to take a shower before your surgery to make sure you're all clean, and to wear a short sleeve shirt during your surgery. It's a local anesthetic, so I didn't have any restrictions as far as eating. I was able to eat before my surgery, and that was not a problem. Also, I wasn't able to get a babysitter, so my wife had to watch the kids. We didn't want to bring them with us. So I asked if it would be okay if I drove myself, and they said it was. This isn't my first surgery I had, and it was on my non-dominant hand. So I had about a 45-minute drive to the surgery center. I thought I would be okay with it, and I was. Actually, I didn't have any issue with driving after the surgery. So if that's a concern for you, I think you'll probably be okay. Kind of depends, I guess, on the hand. So since it was my non-dominant hand, I was just fine. Okay, so for the surgery, before my surgery, they called me back in a room. They took my weight, my blood pressure, and all that. That way they can compare it after the surgery to make sure that I'm okay to be released. But after that, they went ahead and they called me back into the operating room, at which point they had me lay on a table, and then they took my arm and they cleaned it really well for about 5 minutes. After that, they put a divider up between my head and my arm so I couldn't see what was going on. But at that point, they gave me 3 shots to numb my hand, one between my index and my middle finger, one between my middle and my ring finger, and then another one in my palm. And they let me sit there for about 10 minutes or so as it started to numb. In all honesty, those shots were probably the most painful of the whole procedure. They did hurt a little bit, especially between your fingers when they went in. But then after I was numb, they came in and they started messing with my hand. I didn't even know that the surgery had started, but then they made an incision right at the base of my finger. At that point then, they found the tendon sheath and they went ahead and cut that. He then wiggled my finger to make sure that the movement was fluid and that there was no issue. And then at that point, they sutured me up and I just have 2 stitches right there. After that, they bandaged my wrist all up and they instructed me to leave it bandaged for 48 hours. However, they have you move your hand about like I'm doing right now, 10 to 15 times an hour. That way as it's healing, they make sure that everything keeps moving. And over the course of the last day, it just kind of kept moving down and it exposed my stitches. I kept pulling it up. It kept coming off. So I just went ahead and removed it. And then I've just been putting a Band-Aid over the top of my stitches. That way they don't get caught on anything. I took it off for this video just so you guys could kind of see what it looks like. So for the rest of the day, my hand was pretty numb actually. When I went to bed, my index finger was still so numb you probably could have cut it off and I probably wouldn't have felt it. and my movement was not too bad, but I was pretty numb. So the next day when I woke up, I was no longer numb, and I still continued to do my hand exercises. You have to open and close your hand about 10 to 15 times an hour, and they want you to try to stretch that out. Now, this is my hand straight. The finger, my middle finger, which is the one that had the issue, I still cannot straighten it, and I still can't close it all the way. That's because there's so much swollen in here in the base of my hand. I'm trying to show you that. Here's my other hand. There's like no swollen part in there, and here there is, especially up where I got the shots and where they did the incision. So my hand is reasonably stiff, and it seems like it's gotten a little stiffer as time went on. Now they did give me a prescription for it, but I've not taken any medicine with it. The pain's not been unbearable. You do have to keep your hand elevated above your heart, they said, for the first 2 days. So for the most part, I do hold my hand up high when I'm not doing anything, just to let that try to heal the best I can. Now, I have been washing my hands because you need to wash your hands throughout the day for various reasons. I don't know if that's the best thing. They didn't really say anything because it was bandaged up, but from my reading, I've been using a really mild soap. I just am very gentle when I clean the area, and then when I'm done, I dry it with a blow dryer. That way I don't catch those stitches on anything, and then afterwards I put a Band-Aid over it. So I'm going to go ahead and continue doing my exercises. So I'll check back with you guys here in a little later and let you know how the progress is going. Alright, it's been 5 days since I had my surgery, and I'm happy to report everything is going great. Today I'm able to fully straighten my hand and make a clenched fist. I have just a little bit of swelling at the base of my finger, but other than that my hand feels pretty much normal. The pain that I had post-surgery is pretty much gone, with just a very little minor pain remaining. I'm able to use my hand as normal, and there's absolutely no catching. So my hand feels great. Now, this is the first day I've been able to fully straighten my hand all day. After 48 hours, I was able to straighten it in the morning, but after doing the exercises, my finger would start to swell, and then it would be kind of bent down like this. One thing that I started doing that really helped was I would take my other hand, and I'd just kind of put my finger at the knuckle, and I'd stretch it back like this, and you'd feel a little bit of pressure. You want to be careful not to pull your stitches, but stretching that tendon out really seemed to help. Because after doing that, like I said today, I'm able to fully straighten my hand, even after using my hand extensively. Opening and closing it is no problem. Well, I have another appointment in 1 week to get my stitches out, and they're going to do some physical therapy. So after I do that, I'll be back here in just a second to tell you how that goes. Okay, so I just got my stitches removed yesterday, and look at that. That is really, really good. Besides a little bit of dry skin in there, it's barely noticeable. I'm very pleased with how this surgery went. It's been exactly 2 weeks today since I had the surgery, and I would say that my hand is back to normal. I only have a little minor soreness in the incision spot. That's going to be normal. I could have that for another month or two. And it's very minor. I mean, I don't really notice it unless I take my hand and I press there fairly hard. Then I notice it. But that will go away in time. I remembered that when I had the trigger finger surgery the first time. So again, very pleased with how this turned out. When I went to physical therapy, they showed me a couple exercises to continue to do for a month. They wanted me to do these about 4 times a day and do 10 repetitions of each. So one of them was you would kind of hold your finger like this, and then you would bend it at the knuckle. And you kind of do these slowly. I'm probably doing it faster than I should, but I'm trying to speed it up for the video. Another is you hold above the knuckle, and you just kind of bend the tip of your finger like that. Another is just kind of stretching it like that, which I was kind of doing these before I went to physical therapy, just because I was trying to get my finger to straighten. So I was a little bit ahead of the game on that. Again, another one they have you do is just kind of going like this and then like this. So pretty easy. Again, the doctor said everything healed up very well and really good. So looking back on it, would I get the surgery again, or would I try to heal it naturally? I don't think you could go wrong with either way. When I first got the surgery, my hand was all wrapped up. It was really sore. I started thinking I probably should have just healed this naturally because I really didn't like having my hand out of commission. They gave me a note for 2 weeks off work. I went back to work though within about 5 days, so it wasn't a big deal, and I was able to continue my job. But as day 5 came around, my hand stopped hurting less. It wasn't bandaged up, and it wasn't too bad. And now that it's off and it's back to normal, I'm really pleased because I know I'll never have trigger finger in that hand again. If I healed it naturally, again, I always have the chance that it could come back. It's something I'm prone to. Now, if I get it in another finger, hopefully I never do. I think I'm going to go ahead and try to heal it naturally first. Because man, the surgery is so expensive. So healing it naturally takes a little longer. Healing it with surgery, kind of expensive. It's kind of a trade-off, and you just got to balance what works for you. So if you guys have any questions on my surgery or any questions about my trigger finger experience, hey, let me know. I'll do my best to answer you back. And I hope this video helps somebody out there. Thank you for watching.